Hi, everyone. Welcome to MEDENT Minutes, the podcast that explores EHR optimization and how practices can excel in value-based care. I'm Megan Chapman, the Director of Marketing and Communications here at MEDENT. And today we're really excited to be talking about our inaugural Thrive Healthcare Summit with our friends Terri Dowd, Jayson Hobbs, both from FocusMD. And we also have our MEDENT sales consultant and guru, Ed Regis, on with us today. So Terri, Jayson, and Ed, thank you for joining us.
Thank you, Megan.
All right, and just before we dive into Thrive, I just want to get a little bit of background about our partnership with FocusMD, and also Terri, I want to hear about your background as well. So could you just kind of introduce yourselves and talk about how we all know each other through MEDENT and our partnership?
Sounds good. I'll start off, Megan, if that's okay. For those of you that don't know me, I'm Jayson Hobbs. I'm the founder and president of FocusMD. FocusMD is a managed service organization that has a mission to help fix healthcare by supporting private practice independent physicians. We started in 2012 with folks that are doing value-based reimbursement, closing care gaps. And we've grown over the years to be an organization of about 40 employees that provides services across the spectrum in running a practice. From population health management to medical software management and revenue cycle management. My team is very experienced and very passionate about healthcare, and we're very excited to be on this podcast today. So we appreciate everyone's time to share a little bit about what we've been doing with MEDENT over the last several years to expand our service offering to those private practice physicians. I'll let my wife, Terri, go next.
Hi, everyone. I'm Terri Dowd. I have not changed my last name, or it would be Hobbs yet. I'm the executive director of the Independent Medical Doctors Association. We support private practices, many of which have MEDENT. So we're very excited for that partnership. I'm also the ambassador for the Thrive Conference. So the Thrive Healthcare Summit will be made up of private practice administrators talking about optimization and best practices and workflows. We also have a physician panel discussion on the second day in the morning. The MEDENT breakout session is specifically for those who are MEDENT customers, and we're just excited for many of our private practices to participate.
Yeah, and tell me a little bit more about the event itself. I mean, whose idea was this, and how did all of this come about?
So the idea actually came from Dr. Gino Bonarotti. We were at one of my wife's events for IMD, the Independent Medical Doctors Association. There's many independent private practice physicians that attend, and at that particular meeting, Dr. Bonarotti said, it would be great if we had a MEDENT users group because we could share best practices and figure out how to use the tool to really enhance the practice of medicine and help our patients as well as helping the physicians and the staff. So it came from Dr. Bonarotti. I brought it to Mr. Regis and asked him if it had been done before in the past, which of course he said yes, and there was a history of users group. And then it kind of blossomed from there, quite frankly, like most things do when my wife gets a hold of them. As our ambassador, it went from a MEDENT users group to really more of an event to build the community around independent medicine. And so once she came in and got involved as the ambassador, we've expanded the focus to be more inclusive and add other topics. I don't know if you want to add anything to that.
Sure, yes. So we use the foundation of the MEDENT breakout session and said, what else do private practices need help with right now? The communication of, what's in, what's out, what kind of technology is on the horizon, a lot of practice administration help in staffing and HR. How do we really have the staff help us reach our value-based goals and topics like that. And then the second day, we really wanted a lot of physician engagement and interaction. So we're really happy to have a bunch of private practice physicians all engaging together to tackle topics like optimization of tools that are in front of them, and also, revenue generation opportunities for the practice.
Yeah. And Ed, you've talked to me before about how a lot of clients have expressed this desire for more MEDENT user groups, and especially in-person groups since COVID. I think this is our first in-person user group in several years. Am I right about that?
Well, I'll tell you what, it has been a topic that comes up on a regular basis. And in the past, we haven't done anything as formal as Thrive. So one of the things when I brought this to our administrative team, I said, I've gotten to know Jayson and Terri very well over the last 3 or 4 years. And these folks have the ability to create an environment and an event that would encompass everyone. So in the past, when we've done, like I do, what's new? And I try and explain to practices, what's the best way to keep on top of everything that MEDENT is doing. We do a lot of programming to meet industry standards, and we do a lot of custom programs based upon our support team and our training team interacting with practices as they go live and as they've been on MEDENT for 10, 20 years. And all that programming comes back to them automatically. But the problem has in the past been, how do you get people to take the time to know what's new, what's changed, what things they should be taking advantage of? And on an individual basis, I've tried to do that. And then as different administrators have said, hey, Ed, we need to have a users meeting here or there, I would set up that event with them. So this is much bigger and much better. So my goal as far as a users meeting for MEDENT is going to be to understand the topics that some of the practices might be interested in going over, and maybe some type of questionnaire for anyone who signs up to come to the event, so they can say, these are the things we'd be interested in. And then when we do that meeting in the afternoon, be prepared with those answers. And at the same time, giving an opportunity to say, this is what's new, this is what other practices are taking advantage of. And I guess I could have been a little shorter on that, but that's what my goal is, and I'm really excited about it.
Yeah, and do you know how many people from MEDENT will be there to, help folks figure out some of these best practice with this breakout session?
At this point, I don't actually. Barb Cuthbert, who's the vice president, one of the owners at MEDENT, who a lot of people that I've worked with, they know, well, Ed's been there for 38 years. It'll actually be 39 years with MEDENT in May. So Barb was a baby when I started, but she is now, vice president. She knows MEDENT inside and out. I learn from her just about every single day. And so I'm excited to have her coming, and potentially perhaps a trainer. But between Barb, myself, and one trainer, or just Barb and myself, we'd be able to really address and have a wonderful breakout session.
Yeah, absolutely. And yeah, I didn't want to date you there, Ed, but I was going to say you've been with us from the beginning, just about, almost 40 years. So that's why I always refer to you as our MEDENT guru, because you really know your stuff. And I think anyone who wanted to optimize MEDENT would want to hear from you. So I'm glad that you'll be there. And just, what else can we expect from the event? What can we expect to see at this summit? Do we have some keynote speakers? And I know we have a lot of panels. So Terri, Jayson, did you want to talk about what other aspects, other panels might be happening?
Absolutely. Yes, I definitely want to be clear that this first event is our inaugural event, and it is going to be a smaller event than what we plan for in the future. So we are actually limiting the attendees to the first 50 providers that sign up and the first 50 practice managers that sign up. So we are going to keep it to a relatively small group because our objective of this meeting is, number one, to build the community and make sure that we're able to allow these physicians to connect with each other and get to know each other and understand the background and the experience and expertise that they have, but then also share best practices, share lessons learned, share creative ideas for how to combat some of the challenges that we face in this very difficult healthcare climate. So Thursday's agenda is all really geared towards the practice managers. And I've asked Terri to take the lead with that, and she's worked with a group of practice manager leaders in the community. So she's going to talk about that. And then Saturday, is all going to be for physicians. And I have a panel of 3 physicians that have helped me set the agenda, to set the topics, pick speakers, as panelists as well as keynotes. And so I'll talk a little bit about that in a second after Terri covers what's going on Friday.
So Friday is more geared toward practice administrators, CEOs, office managers, people who are in charge of really the operational, business of the business. Also, best practices with human capital management. So the Independent Medical Doctors Association really provides support from either startup private practice or practices who have been running for a long time, but things are changing. You don't want to spend 2 hours trying to find the best shredding company prices. So we become a resource for those sort of discounts and connections. So we really wanted to make Friday just optimization of all things. Our keynote speaker is a gentleman named C.G. Loya. C.G. is a tab, a business networking event director. And at the same time, he has some really good information around culture, keeping staff and helping to run the practice and get the best patient outcomes. Has been, definitely something that I get calls on all the time. How can we have our staff help us reach our goals? And I don't have, a lot of information to give them. So we're really glad to have CG Loya. The other information during the day, I won't go through all of it, but something that's really cool is collections reimbursement, patient responsibility. We have practices who have $1 million in outstanding collections, and we have some really cool solutions that have come up in this innovative technology time where, private practice can really get involved in texting patients their bills to pay and things like that. And we're seeing increases that are beyond 50%, which is amazing. So some of those that are really helping the practice not only get revenue in the door, but also innovating beyond the tools of the, MEDENT and the other, EHRs.
So after we have a jam-packed day on the Friday, I keep wanting to say Thursday, and I apologize. And I may have by accident, so hopefully we can edit that out if necessary. But once we get through Friday, and the physicians are invited to participate in Friday, it's not that we're just making it for practice managers. There's certainly overlap between the practice manager and the physician, but we want to make sure the agenda is geared towards them. And so on Saturday, we're going to start early at 9 a.m. And our first topic is leveraging physician collaboration. We have Dr. James Gardner, who is a successful primary care practitioner in the north of Pittsburgh, going to be leading a panel discussion with 4 other independent private practice physicians. They're going to talk about different segments of how they've leveraged physician collaboration to improve their world and the practice performance. So then we roll into our second panel discussion, which is titled Make the Tools Work for You, which is led by Dr. Brian Lieb, one of the many clients that Ed has introduced me to over the last 3 to 4 years. Dr. Lieb was in employed practice with Conemaugh Health System. He left employment and started his own practice right before COVID hit, unfortunately for him. Fortunately for him, we were able to find ways to optimize his MEDENT, his remote patient monitoring tool set that we built for him during the COVID period. And he has some creative ideas on how, you really can leverage those tools to improve the care for the patient, the cost utilization, as well as the quality of care. And so he's going to be leading a panel discussion with 4 other doctors that are going to talk about topics such as AI in the current environment, and how do we bring that to our healthcare space and allow it to plug in and work with the tools already established. HCC coding, which is a very important topic for those of us involved in risk-based contracts. So there will be a couple different items that will be covered in that session. And then last but not least, Dr. Gino Bonarotti, who is a private practice neurosurgeon, will be leading a panel discussion around alternative income streams and really helping to share best practices and opportunities for physicians to make money outside of patient care. Unfortunately, the world that they live in today, it's harder and harder to make money just by seeing patients. You have to see a considerable amount of patients in a day to make the same amount of money that you did in the past. So figuring out creative ways to leverage their medical expertise to earn additional income is something that a lot of physicians are interested in, and we want to share that at this conference. We'll conclude the day with a lunch and a 12 to 1 p.m. Keynote speaker from Dr. Lauren Loya, who is CG's wife, and also an independent private practice primary care physician that left UPMC corporate medicine and has been thriving as a successful private practice physician for the last 15 years. So she's going to share some of her journey and experiences to encourage the participants of Thrive as to ways to really battle back the challenges of healthcare and lead us forward in our quest to fix healthcare.
Great. And, we actually, we're hoping to make this an annual event. Is that right?
Yes. The event we're planning on making annual, but we're also looking at how do we break this up into small quarterly components, because there's going to be a lot of content that's presented that we're not necessarily going to dive deep on. And as you guys both know full well, MEDENT is an awesome tool. It's also a very complex tool. And if you don't take the time to learn it and understand it and build it and set it up correctly, you're not going to get the full benefit of the product. So something we really understand in healthcare is that it takes time, and we got to really invest our time into learning how best to utilize these tools, how best to combat these adversities that we face so that we can do a better job serving our patients. So yes, long-winded answer. I apologize, Megan, but we do plan on making this an annual event with some quarterly breakouts that will go deeper on certain topics like MEDENT optimization or AI or remote patient monitoring.
Absolutely. Yeah, one thing I always say, is when I'm talking to, doctors or practice administrators, they did not go to school for IT or technology. That's not really where their passion comes through. They get their passion from, either helping the practice succeed or, helping their patients. And technology, if it's used, if it's optimized and used in the best way, it can really make such a huge difference for a practice. But you're right, it's a very complex, there's so much that goes into it. So I think those quarterly, more detailed sessions can absolutely be incredibly beneficial.
Yeah, I couldn't agree with you more, Megan. Healthcare is a team sport. Let's be honest. We haven't really operated as a fully functional, effective team in the past, and we got to get there, because it's a time for us to take U.S. healthcare to the next level, and provide the high quality care that we all know we're capable of. But that requires you to trust your team and requires you to work with folks like Ed, who is the MEDENT expert of 39 years to teach us. Every time I get on the line with Ed, I learn something new about MEDENT. And I appreciate that about our relationship is because it's always evolving. You guys are always adding to the software. You're always making it better. You listen to the clients. You want to hear from the providers, and you take that feedback and make the product better. So again, another opportunity at this conference is for that interaction between the providers and MEDENT, so MEDENT knows where to put their valuable resources to make the product better. So
absolutely.
That's the team that we're looking to continue to build and evolve so that we can serve our patients better.
Yeah, no, and that's great. I was going to bring that up too, that, this is not just an opportunity for, people to share their best practice or their workflows, but it's an opportunity to kind of, speak to us directly and say, hey, here's where you could improve, or here's something that we need, or here's different ideas for MEDENT to actually, for us to bring back to our programmers and say, hey, we need to make this a little more efficient, or here's a new idea. So I think it's a great opportunity. And there's nothing like getting together in person. I think we've all had so many virtual meetings and events over the last, 4 years that I think it'll be really nice for folks to kind of get that in-person networking going again.
And we understand fully that Pittsburgh's not the most tropical of locations, but it is where we live, both myself, Terri, and Ed. So that's why we picked Pittsburgh for our inaugural event. But we're hoping to expand it and add it to different locales across the country. I don't want to speak for my wife, but I know she loves Florida. So don't be surprised if Thrive comes to Florida in years to come.
Yeah. Everyone will say it.
Yeah, right. And I did want to mention, I know that we've, MEDENT has offered to kind of, co-present the event with FocusMD, but are there some additional sponsorship opportunities that we wanted to mention as well?
There are. We're really, really happy to have also a banner sponsor being Alera Group, who's a insurance provider that we work with very closely in private practice. We also have some innovative technologies, DermaSensor and some others who have come on as sponsors for us. All of the relationships that we have in private practice really feed in. So we are going to thank all of our sponsors here coming up soon.
Great, yeah. And how can folks reach out about sponsoring the event if they're interested?
My email would be great. It's Terri, T as in Tom, ERRI @wythu.com. It's WYTHU. I'm happy to answer any questions that you might have. We also have the opportunity at the Eventbrite link. If you search for Thrive Healthcare Summit Pittsburgh, the link comes up with the agenda. That's where you buy tickets and also can inquire about sponsorship opportunities.
Great. And I do want to also refer people to our blog, medent.com/news, where we will be having more information on Thrive as well. And I think my last question here for you guys is, what's the deadline to register? And what's the target audience here? What's the turnout that you're hoping to see?
So again, we are taking the first 50 registrants, and then we're going to close registration. So there is no deadline to register, but we are encouraging folks to get online. We have probably 24 registrants already. So we're about halfway there already, and the program's coming up in May. So we strongly encourage people to get online, get to the Eventbrite link and register, because we want to really make sure that whoever's coming, we've got a very tailored approach to them, and they're involved in the sessions and the event in a meaningful way. So again, no deadline to register, but it is a first come, first served basis for the first 50 providers and practice managers that register.
All right. Well, thank you guys so much for being here with us today. And yeah, very excited to see how we all thrive next month.
Thanks, Megan.